Hey everyone, Dr. Gage here today. Today we're going to be describing what we like to call as our healthcare funnel. Now this is how we typically would manage most musculoskeletal conditions. There'll always be an exception, but typically for a musculoskeletal condition that you might consider receiving medical treatment for, this is where we like to develop this funnel and how we're going to help you manage that case. So we start with step one, where that injury happens here. The first thing we want to do is some self-treatment. This can be things like a heating pad, ice pack, some at-home stretches. You can even do some at-home exercise that you might find through a little research online. The only thing is, you gotta be a little careful trusting Dr. Google. So we typically will then refer to a conservative care option. So as we move down that funnel, in comes conservative care. Now we want to do a conservative care because it's non-invasive, it's the cheapest option, and a lot of standard musculoskeletal complaints can be resolved with a conservative care option. So someone who works in conservative care would be a chiropractor, physical therapist, massage therapist, or an acupuncture. So those are some great conservative care options. Obviously with ourselves being chiropractors, we can do things like the rehab exercise. We help you get your diagnosis, specific exercises to rehabilitate that injury that occurred, as well as address things like joint dysfunction and soft tissue restriction in the area. Now, if we've done a trial of conservative care and we haven't seen the results necessarily improve or get better at the pace we would like to be, we then can move down that funnel and we can go to something like imaging. Here we have CT, we have MRI, we have X-rays. Sometimes it's beneficial to help get that imaging to know what's going on just with a little clearer picture underneath the layers. Make sure for things like small fractures or tears in muscles or tendons. And it helps us kind of identify and better build that treatment plan that we incorporated here, or reestablish a new treatment plan that can help deal with that musculoskeletal injury. Now, after imaging, like I said, we can typically work back up and address it with conservative care here. Sometimes that imaging isn't going to change what we need to do on our end of things as far as treatment goes. Sometimes it will, but it'll help us better tailor that in the moment there and moving forward with that injury that you've sustained. If that is not the case here, then after imaging, we may find some findings that allow us to say, best judgment here going forward be to get a proper referral and have a second set of eyes on this. So there we'd move downward here towards a referral, and that can be with a neurologist, an orthopedist. That can be just to get a second set of eyes on there. And with that doesn't necessarily mean that a referral is going to lead to any sort of surgical consultation or anything like that, but it does allow us to utilize that team factor into managing your case the best way we can moving forward. So this is just an overview of how we like to build that healthcare funnel for you here at HealthFit. If you have any questions, feel free to reach out, and look forward to seeing you guys in the future. Take care.